Hi, everyone. Thank you for joining us for this webinar, which is part of our series of presentations funded by the Australian Government Department of Health, Disability and Ageing. And what these webinars and webinar series are all about is how to apply evidence into practice, which is part of our comorbidity project. My name is Christina Morell. I'm an Associate Professor and Deputy Director of Treatment and Translation Research and Program Lead of Treatment and Translation in Complex Populations at the Matilda Centre for Research in Mental Health and Substance Use here at the University of Sydney, where I also lead the comorbidity project and work with a great team. And I'm joined by some of my team today as we bring you the webinar today, which is being presented by Dr. Erin Kelly. But before we get into that, I would like to acknowledge and pay respects to the traditional owners of country on which we're meeting and recognise that we are, of course, joining from many traditional lands across country. The traditional owners of the lands that I'm currently on are the Gadigal and Wongal peoples of the Eora Nation. And I'd also like to recognise their continuing connection to land, waters and skies, and acknowledge the same for traditional owners of the lands that you're all joining from, and pay respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander people who are joining us today. I'd also like to recognise and acknowledge the many people with lived and living experience of mental health conditions and substance use, as well as their families, carers, loved ones and chosen families, many of whom have been involved in the comorbidity project and our development of resources over many years. Whether you're joining us live or watching the recording, you're all in listen only mode, which means that we can't see or hear you. So I'd like to draw your attention to the Q&A and chat buttons on your screen. If you have any questions for Erin during the presentation today, please feel free to use the Q&A button. If you have any comments or anything other than Erin today, please use the chat button. And this just helps us keep track of what questions we pass on to Erin, or whether there are any other requests for support or technical issues that we need to help with. The recording and slides will be available for download from our website in the next few days. If you find Zoom chat distracting, you can have a play around with the settings on your end to disable what messages you see. And to do this, you just need to go to the Zoom desktop app. If you have it installed, click on the settings wheel in the top right-hand corner of the screen and have a play around with the notifications and sound in the navigation menu. You can toggle off the option to preview messages or chats. And I think Madhu will post the link to this in the chat if you want to have a play around with it later. Before I introduce Erin and hand over to her to get started, I just want to mention that you can access our webinar library at our website. The link to do that is on screen there, and we'll also post that in the chat. And if you have a couple of minutes at the end of the webinar today, if you could take a moment to let us know if you have any feedback or suggestions for future webinars that you'd like to see being part of this series. And thanks so much to those of you who have sent through feedback for suggestions after the past few webinars. And in fact, today's topic is brought to you in response to some of your feedback. So please keep sending those suggestions through. We do look at what you send us. And now it's my very great pleasure to introduce our presenter for today, Dr. Erin Kelly. Erin is a clinical psychologist in private practice and a casual academic at the Matilda Centre. She has over 15 years of clinical experience and 20 years in research, focusing on the treatment and prevention of co-occurring substance use and mental health conditions. Erin has worked in a range of settings and is experienced in delivering both individual therapy and group programs, and is also an experienced trainer and educator. Erin has also delivered wellbeing programs in areas such as stress management, self-care and self-compassion, and especially enjoys working with healthcare workers and other professionals who are dedicated to helping others, supporting them to care for themselves with the same dedication that they give to others. I've known Erin for a few years now, and I'm so pleased that she was able to deliver this webinar today. Thank you again, Erin, and I'll hand over to you to get started when you're ready.
Thank you, Chris. Thank you for that lovely introduction. And yes, we have known each other for a fair while now. So it's very exciting to come and do this presentation, particularly in an area that I am so passionate about. Welcome everyone to the webinar. So before we get into the content, I thought we would do a bit of a warming up grounding exercise with the exercises. They're totally opt-in and do as much or as little as you like. And this exercise is inspired by Chris Irons, who is a compassion trainer, clinical psychologist, and he uses the analogy of, say a sports star that would warm up before a game, that it can be very helpful to warm up before your work. It's not something that's explicitly taught to healthcare professionals, but it can be something to help you kind of slow down, ground, tune in, and warm up some of those qualities that you do want to bring to your day or to the people that you're working with. So just taking a moment, be tuning into where you are, here in the room. Maybe just kind of slowing down your breathing and noticing your physical sensations, maybe your body against the chair. And really preparing your body to help your mind. Slowing down your breath. Opening up your posture. Sitting up straight. Opening. And starting to conjure up some of the qualities or strengths that you want to bring to this webinar. So is it the care that you have for the people that you work with? Hopefully the care that you have for yourself. Is it your interest in learning, your openness to growth, change? Kind of embodying those qualities, whatever that means for you. Kind of really picturing yourself having those qualities right now. And keeping those with you as we finish up the exercise. Connecting back into your body, your feet against the floor, turning to the room. As part of what I want to bring to the webinar today, I would like it to be a little interactive if we can. I know it's hard with the webinar, but I've got some reflections that you can pop into the chat, but also don't feel any pressure to. If you're kind of really tired, you just want to listen, that's okay. If you just want to take in the information, reflect later, that's okay too. So the main objectives for this webinar, and compassion is such a huge area, so it was hard to kind of rein it in, but the main focus of today is just getting a basic understanding of what compassion is and why it does matter for work, but also in your personal life and for those that you are caring for. A really big area for compassion is barriers to compassion. We'll delve more into it, but it's a simple but difficult thing. So there's lots of barriers to compassion that we come across. So understanding some of those and starting to recognize how they might show up in your own work. Then lastly, just some ideas for ways to strengthen compassion in your work that we're not going to have time to go through whole compassion training, just some brief ideas of how to start being more compassionate in your work, in your life. So first of all, what is compassion? What comes up for you when you consider what this word means? I just realized I can't see the chat after asking. There we go. Sorry, bringing that back up. So feel free to pop it into the chat or just be thinking yourself, when you hear this word compassion, what comes up for you? What do you think that means? Empathy, it's an interesting point, which I'll get to later. Kindness, understanding, warmth, yes. Alleviating pain, understanding. Wow, these are great. Relieving suffering. Nice. So lots of great points here, and a lot of that is covered in compassion. What I'll be using today for the definition of compassion is that from compassion-focused therapy. I should have done this intro before, but basically I first learned about self-compassion when I started in private practice, maybe 2012. That was more the kind of Kristen Neff's model of self-compassion. From there, I got interested in compassion-focused therapy, which is developed by Paul Gilbert, which a lot of you probably are aware of. And then also I've been trained in compassionate mind training, which is more of the non-clinical form of compassion. So I'll be using the definition of compassion that's used within compassion-focused therapy or compassionate mind training, which is a sensitivity to the suffering of the self and others with a commitment to try to alleviate and prevent it. So that came up a lot in people's suggestions for the definition, so you're all very clever. The two main points are the sensitivity to the suffering, so that's that ability to engage with the suffering so that you notice distress in others or yourself, and that you stay with that pain, so kind of moving towards those emotions rather than avoiding. That involves things like tolerating distress, ability to be present, ability to cope with discomfort. There's a lot involved in that first part, that engaging with the distress. That's often where people stop. It's, it's that engagement. That's what people often think of with compassion, but within this definition, it's very action oriented. So it's also the commitment. So that willingness to actively work toward preventing or alleviating that suffering. So it's an intention or a wish to reduce that suffering, and it involves taking wise, dedicated action to alleviate that suffering. Some important qualities involved with compassion. Firstly, it's important to know that compassion in this framework is seen more as a motive than an emotion. So it's not just the feeling that comes up, it's that motive or a motivation to alleviate suffering. And that can be very helpful because you don't actually have to like someone to be compassionate towards them. And that is also important to know that that follows for yourself as well. You don't have to like yourself to be self-compassionate. Compassion is contextual. So compassionate responses really differ depending on the type of suffering. So it could be emotional suffering, it could be physical suffering, it could be resource-based suffering. And compassion requires courage and wisdom. So as I mentioned, it takes courage to face difficult emotions and to stay present with those. So it's something that's difficult to do. And also compassion can be hard. So it's not necessarily doing the easiest thing. It's doing what's most likely to alleviate that suffering. So that can be difficult things like having difficult conversations, setting boundaries, doing what you know is best for you rather than what would be easiest or nicest. Also involves wisdom. That might be being able to see the bigger picture, balancing those short-term and long-term kind of positives, knowing, even though this might be what I feel like doing now, what could be really beneficial in the long term. Also knowing what might help. So say if someone has emotional suffering, what do you think would be actually most effective for them in that moment? And then that wisdom to choose the effective action. There's lots of misconceptions about compassion. We'll cover these a little bit in the barriers to compassion as well, but just to raise them here, even probably already hearing, these ideas about compassion, some might already be coming up for you. So common ones might be that compassion is weak, but really the evidence kind of shows us that it actually can be hard and strong and firm, particularly because it is focused on that long-term benefit. It's not kind of, eating pizza in bed because you've had a hard day. It might be actually validating that it's been hard, but choosing the action that's going to be most beneficial for you, like going for a walk or something like that. There's also ideas that compassion is selfish. I guess that's particularly with self-compassion, but really, what we know is that you need to be able to manage your own self-care to be able to effectively help others. And there's that analogy of the oxygen mask. There's a reason that we have to put on the oxygen mask for ourselves first before we help other people. So it's important for us to take care of ourselves, particularly when we are in charge of kind of helping other people. There's lots of ideas about, I guess, almost the opposite of compassion, that, being kind of self-critical, hard on yourself is really effective. And that's what, if you gave up on that you suddenly wouldn't be motivated or wouldn't be successful. But often we find the opposite for that too, that really when you're really hard on yourself, really self-critical, that activates your threat response. And we all know that when you're under threat, it's very hard to think clearly and to act effectively. You're more likely also when you're kind of feeling, when you're being very self-critical, you're more likely to feel shame. And that also leads to withdrawal and avoidance. So you're less likely to take action or acknowledge your weaknesses and try to improve them when you're being self-critical. Similarly, there's an idea that compassion might make you lazy, but there's evidence that compassionate people are more likely to persist after failure, and they're more likely to take responsibility for their mistakes. There's many more misconceptions which we can chat about soon, but just to know that there's a lot of ideas about compassion and lots of experiences of compassion that can make it difficult. So as I said before, it's kind of simple, but it's also really hard. Another common misunderstanding in relation to compassion is about compassion fatigue. So that's a term that's often used to describe the distress and exhaustion of healthcare professionals after prolonged exposure to the suffering of those in their care. But research and brain imaging has actually shown that compassion fatigue is a misnomer. There's something very different happening in the brain when people are experiencing compassion versus empathy, particularly empathic distress. And that the term really should be called empathic distress fatigue. So empathic distress occurs when a person over-identifies with the other's suffering and experiences distress themselves, which actually triggers the pain network in their own brain. So empathic distress is self-focused and it's an aversive response, whereas compassion is other-focused, concerned about the other person's suffering and helping that person. It's action-oriented and it's a positive response. So really empathic distress is not caused by being too compassionate. It's actually caused by a deficit in compassionate skills. But the good thing is that compassion can be learnt. And we'll go more into learning compassion later in the webinar. So compassion is not just something that we give to other people. It can also be something that we receive from others, something that we give and receive to ourselves. So within the context of work, that might be providing compassion for clients or patients, people you work with. It might be colleagues, other people that you're working with. Similarly, accepting compassion from others might be accepting support from your colleagues or from supervisors. And then compassion for oneself, which is self-compassion, involves both of those aspects. So it's the ability to provide compassion to yourself and receive that compassion. So let's do some reflection and feel free to pop these ideas into the chat. First, I'm interested to know, I guess, how did your definition of compassion differ from the compassion-focused therapy definition? And from what I could read in the chat, a lot of you did already have a good understanding of that more compassion-focused therapy definition. But I'm wondering if there's others that were surprised by that definition, or those aspects of compassion that they weren't aware of or hadn't recognized before. Yeah, importance of action, I think, is very important. And seeing it as a motivation and action more than a feeling, I think, is very helpful. Empathic distress fatigue, yes. Every time I hear compassion fatigue, I tense. So the more people that understand that differentiation, the better. Yeah. Thank you. Next part's starting to look into which aspects of compassion you think might be most difficult for you. Do you think that's that noticing distress, whether it's yourself or others' distress? Is it maybe the engaging with distress? Again, your distress or others' distress? Is it taking action to alleviate distress, yours, others? Or is it receiving compassion from others? And maybe at the same time, because they're related, what might make these easier or more difficult for you? For example, who is suffering? Is it easier for you to notice distress if it's others than yours? The type of suffering. So is it easier for you to be compassionate to someone, say, with physical distress or difficulties than emotional? What kind of actions are more comfortable and more difficult for you? Are you much more comfortable providing kind of emotional support, say, than practical support? And what aspects make receiving more difficult or easier for you? Again, are you able to take practical support, but emotional support might be hard, or vice versa? Yeah, it's interesting. I think in this area of work, people often might find engaging with others' distress is easier than just engaging with their own. Yeah. Yeah. Interesting. And of course, other factors are going to influence these as well. It might be, can be more compassionate when you've had a good sleep, or can be more compassionate when you feel more confident in providing help to those people. So there's lots of kind of factors. Yeah, interesting. It can often be easier to be compassionate to clients than it is to your own friends or family. That would be a very interesting one to dig into, I think. You're feeling depleted, yes. Okay, gosh, I want to keep reflecting on these, but I'm aware of the time, so I'll whiz through. But there might be more time in the Q&A to talk through these as well, but very interesting reflections. Okay, so why does compassion matter in healthcare? We think of this in terms of the three flows. Compassion has a positive impact on those who provide the compassion, who receive the compassion, and even for those witnessing compassion. People with higher self-compassion have lower levels of anxiety, stress, depression, self-criticism, and shame. Providing compassion to others increases sense of well-being, meaning, contribution for the provider, and can buffer your own stress and anxiety. The ability to receive compassion from others is associated with lower levels of anxiety, stress, and shame, and higher levels of well-being. So it's very good for you. There's also some evidence on the neurophysiological benefits of compassion. So it's shown that compassion actually activates brain regions involved in affiliations, kind of caring for others, nurturing, positive affect and emotion, and reward processing. So actually, compassion fosters positive affect when confronted, even when confronted with the distress of others, which I think is that buffering effect. There's evidence of structural changes and increased plasticity with compassion practice. So actually your brain is changing to improve over time in its ability to cope with stress and regulate emotions. There's evidence of increased heart rate variability, which basically is an indicator for self-soothing and emotion regulation, and evidence of reduced stress markers. So again, kind of indicating that compassion leads to a more adaptive stress response. There's lots of benefits being found of compassion for healthcare professionals. So people that have done compassion training often find reduced stress, anxiety, depressive symptoms, fatigue, self-criticism, and burnout. Increased compassion for themselves and others, and reduced fears of compassion. I'll go a bit more into fears of compassion in a moment. Increased well-being, positive affect, job satisfaction, and professional quality of life. And improved patient relationships, communication skills, more patient-centered care, improved coping with difficult work situations. And just to note, there's lots of different types of compassion and compassion training. Some of the common types are compassionate mind training, as I mentioned, compassionate cultivation training, mindful self-compassion, and loving kindness meditation. So research is on a combination of different approaches, and they're some of the most common ones. Organizations really benefit from compassion as well. So compassionate leaders promote culture and health organizations that explicitly values the well-being of the employees, and then those people are then better equipped to provide care, which makes sense in terms of that then compassionate health systems deliver higher quality care. So patients report greater improvement when their healthcare provider is compassionate. They report less stress ratings, less pain ratings, and improved well-being. There's overall improved patient experience and better compliance and adherence. So very beneficial. Let's do some reflecting. So what about for you? What kind of benefits have you noticed or experienced in your role or in your workplace generally? Firstly, in relation to providing compassion to a client or a colleague, or receiving compassion from a colleague or a supervisor, or, providing compassion to yourself. Feel free to reflect in the chat as well. What kind of benefits have you noticed? Relationships, self-esteem, continued engagement and trust. Yes. Compassion is relational, so it makes sense. Belief, genuine. Yeah, easier to build rapport. Openness. Yeah, positive emotions. Increased joy. Yay. Sadly, many alcohol and other drug clients have negative experiences of healthcare, so actually showing compassion can surprise them, which can build that trust and rapport. And mention soon, actually, sometimes that can be upsetting for people to actually experience compassion for the first time, or they're not used to compassion. So it can be difficult for people as well. More hope. Yeah. Compassion from colleagues. You feel more supported, less alone. And that helps you, be able to cope. We kind of know that intrinsically, if someone, say a friend, has to go to the doctor to get some difficult test results or to go to the hospital for a, operation or something, we often want to go with them to support them. We're not going to be doing the operation or doing anything to practically change the outcome, but we know that being with them, supporting them, is going to be helpful for them. So it's, something that we tune into intuitively. sadly, there are a lot of barriers to compassion. It can be a really hard thing to do. Barriers to compassion within CFT are often referred to as fears, blocks, and resistances. They come from a whole variety of reasons, like everything with humans. So trauma, attachment, negative experiences, and then within compassion-focused therapy, there's actually a lot of focus on evolutionary psychology, so kind of looking at where these things came from in terms of adaptation. It's really interesting as well. The fears, blocks, and resistances can inhibit compassion motivation across all three flows of compassion again. So make it harder to others, from others, for self. And as we kind of acknowledged in the chat previously, it might be different according to different types of flows. So you might have fears related to compassion for yourself, but they don't apply to compassion for others, for example. So it's very important to know about these, to acknowledge them for yourself, to try and understand, where they come from, what's happening, and validate them for yourself, often before you can develop the compassion practices. And they can be, make compassion very difficult if you're not aware of them and you haven't addressed them. So it's an important aspect. So there's a lot of fears, but some of the common ones that I mentioned before, that compassion is weak, self-indulgent, or self-pitying. There can be fear that compassion efforts might be seen as incompetent, unhelpful, or rejected. So, if you try to be compassionate to someone, they might reject you or, not appreciate that action. And there can be fears that compassion from others is manipulative or self-interest. It's hard to actually believe that that person wants to help you or wants to support you. There often can be a lot of discomfort or pain involved in engaging with the suffering, which we mentioned in the chat as well. So people can be very fearful of being overwhelmed by their own emotions or the distress or needs of others. And actually connecting with compassion, even though it's positive, it can have then maybe a secondary emotion, sadness or fear, anger, emptiness, shame. It's almost like that recognition of, I haven't had this before, or I miss this. So it can bring up a lot of old wounds, trauma and attachment wounds, maybe grief, loss. And that's not a bad thing when it comes up. It's just the awareness of knowing what's happening and working with that, kind of understanding that that's often something that can happen. And just, knowing it's very important for people to feel safe and have that trust before they can access compassion for those reasons. There's also blocks to compassion. So there might be environmental, someone might want to be compassionate, but just like, I don't have time, I don't have the resources. I can't, put the time into it. It might be more of a non-deserving kind of block, like, well, yeah, sure, that's all well and good, but my job is to help other people. I don't have time to be prioritizing myself. I'm okay. I don't really need it. I'd rather be focusing on the other people. Or lack of a template. If you grew up in an environment where there wasn't much compassion, it can be hard to know what compassion looks like or how to provide compassion. There's also resistances to compassion. So that's when someone chooses not to be compassionate. They see no point to compassion. Sometimes that's got an evolutionary basis. There's some people that are more focused on competitive self-interest than compassion. So it's the control and hold motives versus care and share. Competitive motivations are really common amongst people that are very narcissistic or hyper-competitive. So they can be very resistant to compassion. And also people that are high in those kind of callous unemotional traits can have an indifference to suffering of others, in combination with the perception that, helping others would be costly for them. So, they need to to take care of their own interests. And of course, there's a lot of system or organizational barriers to compassion generally and in healthcare specifically. I'm sure lots of us can relate to things like workload pressures, multiple demands, time pressures, excessive workloads, resource constraints, like funding and drug and alcohol, for example. And so when systems are under immense pressure, there's limits to what healthcare workers can do. On top of that, a negative organizational culture, for example, cultures that are very focused on efficiency and productivity over connection and well-being, or have a real lack of compassionate support themselves, obviously would really impact compassionate responses in healthcare workers. And while multi-level approaches and compassionate leadership is needed to address those bigger systemic and organizational barriers to compassion, there is still a lot that we can do ourselves to cope with our own distress and partly the distress from those barriers. But also sometimes it might be kind of that idea of fierce compassion. Maybe it's taking action. Maybe it's bringing things up at staff meetings or taking other kind of forms of effective action to address or help to address some of those more organizational barriers. And some specific barriers that are common amongst healthcare professionals. There's quite a lot when I was thinking about these, but these are just some of the initial ideas that came to mind. Find that healthcare professionals can be really hard on themselves. They're quite prone to kind of perfectionism, high standards. So when they kind of make a mistake or feel like they haven't done well enough, they can be very self-critical and maybe avoid sharing that because that fear of judgment or shame. I think people are also can be hard on themselves in terms of their expectations around their role and not prioritizing their own needs. So that focus on, taking care of others and denying your own needs. Just generally discomfort and asking for help or being vulnerable, expressing those emotions or thinking that, you should be able to cope with things or not wanting to burden other people. And of course, empathic distress, as we've discussed. So it can be very hard feeling overwhelmed by people's pain and coming across a lot of difficulties, particularly in combination with those kind of external barriers, and you feel like you don't have much control over those. So that can lead to a lot of distress for healthcare workers, withdrawal, burnout. And so these are some initial ideas for working with some of those barriers to compassion for yourself. First of all, just as we said, acknowledging them, knowing about it is very helpful. And then as they come up in the moment, noticing and naming those. So it might be like, well, I'm having a thought that taking a break would be lazy. Normalizing the barriers. So both, okay, this is a common barrier. Other people, my colleagues also experience this. And, they're here for a reason. I know where these came from, in my history or, evolutionary for protection, etc. Taking it gently, so very small steps, knowing it can bring up a lot. So kind of taking it very gradually with compassionate practice, knowing it's a skill. So it's not a feeling that you should just have. It's a skill that can be learnt. And with any skill, it takes time. It takes a lot of practice. There's evidence that compassion improves the most, which makes sense, with regular practice. And also importantly, practicing it in the moment. So applying it to difficult times. So your own suffering, other people's suffering. And finally, get support. So that might be practical support in terms of actually doing, say, compassion training. There's lots of formal kind of programs around, and I'll give you some resources for those. Might be accessing supervision around them, peer support, or you might find that starting to work on compassion does bring up some of those barriers or difficulties, to actually getting some professional support in addressing those barriers and increasing your compassion. So reflection, which barriers resonate most with you? And how have those barriers impacted your work? So are they, those external barriers that you've noticed the most or that have impacted the work the most? Or have you noticed some fears around compassion and how have they impacted your work? Or do you have more, say, some blocks like, this is not something that's important for me, or I can cope without this, it's not something that's important, I should be focusing on others, etc. Others being resistant compassion, that's true, yeah. The external environment, resource constraints. Yeah, overwhelm. There's so many things to do in jobs and life that it's just maybe another thing on your to-do list. Yeah, fear of being judged, organizational constraints, value conflicts. So often is a combination of, both those kind of external barriers and the internal barriers. So kind of looking at, I guess, that serenity prayer, what can I control and what can't I control? So with the external barriers, are there some effective actions you could take, but also validating those difficulties for yourself, for others, with others? And then the internal barriers, what effective actions might you be able to take? So, compassion practice. So it's interesting, with compassion being such an important part of health care provision, that it's not often explicitly taught to healthcare professionals. That is changing, and it's something that's becoming more common. And there have been a lot of interventions now that have been designed to specifically increase compassion for healthcare workers, and mostly in order to reduce empathic distress and burnout. So it's not so much about improving healthcare workers and their compassion for others, because it's usually what they're good at. It's that being able to tolerate all of that distress and difficulties that they're experiencing, and also providing that compassion for themselves and their own difficulties. So compassionate mind training is one example. It has a good evidence base, trying to help reduce burnout and empathic distress by teaching skills to cultivate compassion. So it has a big psychoeducation component, learning about compassion, our tricky brain, emotions, and then a lot of practical exercises. So ways of engaging our soothing system or activating our soothing system, our parasympathetic nervous systems, there's the breathing, which is commonly known as soothing rhythm breathing within compassionate mind training, body posture work, as we did at the beginning of the webinar, mindful awareness, compassionate imagery, addressing self-criticism and shame, compassionate assertiveness. There's a lot involved. It's usually about 8 to 12-week intervention. So, we won't be able to cover it today, but I just put together a few ideas for starting to strengthen compassion in work as a healthcare worker. So that mindful awareness, so noticing the suffering, labeling it, noticing where it is experienced in the body. Ways of activating the soothing system, so it might be practicing that soothing rhythm breathing, which is, slow belly breathing. There's often a focus on an inner smile or a, tiny smile. And even at a small level, it could be a practice of taking a few conscious breaths before and after each client, transitioning from one client to the next. Similarly, doing something soothing after work, something that engages the soothing system rather than, numbing. Often it's, if you're exhausted after a day of work, you might want to just kind of escape through, Netflix binging or scrolling on the phone, etc. Being compassionate with people that we're working with. Of course, people are often wanting to just escape through drugs and alcohol. It's all the same thing, really, trying to numb and escape from those difficult feelings. Instead, trying to engage that soothing system as well. So, being wise, what might be more beneficial for yourself to provide that soothing after a day of work. Is it 3 hours of scrolling on your phone while watching a Netflix show, which is not something that I would ever do? Or might it be going for a walk with a friend or something like that? Compassionate imagery. A nice one is kind of creating and practicing an ideal supervisor. Hopefully you have one, but if not, it can actually be imagining someone that embodies all those qualities that you would wish for in a supervisor, and even picturing that. So you might have had a tough thing happen at work, and you can kind of conjure up what would that supervisor say to you. How might they support you in that? And that can often be more difficult than self-talk, which can be more self-critical. Compassionate thinking and reframing. This is commonly that idea of, speak to someone, speak to yourself as if you would to a friend, like a close friend. Why are we so mean to ourselves? We're living with ourselves our entire lives. We may as well kind of be supportive rather than difficult. With a work context, you could maybe try speaking to yourself as you would a colleague. So if, you feel like you didn't do great with a client, would a colleague say to you, like, geez, I think you should quit. You're terrible. I can't believe you even bothered turning up. Or might a colleague say something like, look, I know you really care about your work. You did the best you could. You couldn't have known, blah, blah, blah. Just stick in there. I'm here for you. They can be much more supportive phrases. Common humanity is very important. So really recognizing that everyone feels pain, everyone makes mistakes. So for yourself, making a mistake, I'm sure other healthcare professionals have made a mistake before in their lives, or, maybe for clients, just like me, this person wishes to be happy and not to suffer. That can be helpful when you're having that difficulty, being compassionate for someone you're working with, kind of recognizing that common humanity. And then compassionate action, that actually looking at what's going to be most effective in supporting myself. What can I do to cope or look after myself right now? Also, there might be compassionate actions at work. So could be setting boundaries with the clients, actually very helpful for them and for yourself. Assertive communication with clients, with colleagues, taking your lunch break, small acts of kindness at work to increase that compassion in the workplace, being supportive for a colleague, just ways to engage that compassionate action for others. So, sorry, I better speed up now. So quick reflection, some of your key takeaways from the webinar as we're wrapping up. So maybe something you found interesting or helpful. And then what's one small compassionate practice you could try maybe today or this week? Remembering to practice compassion consistently with clients and being compassionate to oneself when you don't remember to be compassionate to clients or when it's difficult. Non-tech relaxation time, yeah. It's so hard. It's just so enticing. Consistency, learning more. I can help you with that shortly. I hope I get a copy of your chat too, because there's so much in here and I wish I had more time to discuss these, but I better whiz through because we're almost out of time. Oh, hang on. We've got some, oh yes, compassionate practices. Ooh, advocating for organization. Yes, that's a great idea. So quickly in the next steps before we have a few minutes for the discussion, I just included some of the key references on compassion focused therapy, but good old Google's there for you. The Compassionate Mind website's amazing with information on CFT, training, research, resources, audios, etc. There's also one for Australia. Balanced Minds is great too. There's also Compassionate Mind research at the UQ. They actually got a compassion, what's it called, symposium coming up in November. Stan Steedle and James Kirby are involved in that, so they both have a lot of information on their websites as well. So there's a lot of information, those slides, those links, for how to take up compassion training in Australia, to just generally find out more about practicing yourself. Yeah, I might do. Yeah, quickly do this one. So the warming down is another important aspect of your work. So Chris Irons also said, in addition to that warming up, you can be warming down from work. So kind of helping you transition from your roles, recognizing what's come up from the day, and setting your intention for how you want to be in your personal life. We might be going, people might be going back to other parts of their work now. So kind of picturing, what do you want to bring maybe from the webinar today with your work, for clients, for yourself, or you might be going into your home life now. So kind of picturing, okay, what's come up for me from my day today? What do I need to take care of that to kind of leave at work? And then how do I want to be in my personal life tonight, in my relationships? And just some kind of slow breaths as you're picturing those. The posture, really kind of tuning into those intentions. That's it from me. These are my details. So feel free to email me as well if you have any other questions. Also, if you'd like support yourself, if you'd like to do some more kind of compassion work, I'd be happy to help you with that. Or if you noticed a lot come up with maybe there's barriers to compassion and it feels difficult to work through on your own, I'm happy to work with people around that as well. So yeah, feel free to reach out, and I apologize that I've only left 4 minutes for questions.
Well, thank you so much, Dr. Erin. That was fantastic. And as our community know, for those of you who are on the community of practice, we do have you back for a case study discussion, which is super exciting. So I'll encourage you all to send your questions through, send your case studies through. We do look at all the chat. We will get that to you as well, Erin. And we'll make sure that we address everything that's come up today. And if you have anything else, please send it through. But we do have one question in the Q&A, which I thought we would just pop to you, if that's okay, very quickly, which is, where does the fix-it impulse fit with compassion? We had another question around this too, as in, how do we fight the, I want to go straight to solutions impulse? How does it fit with compassion? I've probably thrown 1 minute for an answer.
Oh gosh, such a great question, and something I struggle with too. I think part of it can be a bit of intolerance of distress. So a bit of, I don't want to engage with the feelings that come up. I want to fix it, get rid of it. So that in that instance, it's more about like, okay, what am I trying to avoid here? Or, you know, do I need some more skills in, you know, say coping with distress? Or is it purely that being compassionate to myself, giving myself that soothing, I am more able to engage with that distress before I kind of move to that compassionate action.
Fantastic. Thank you. Thank you again. I know that lots of people need to zoom off straight at 2 to go elsewhere. So we will close out for today. And thank you so much. And we will see you next week.
Thank you, everybody. And thank you, Erin. I especially enjoyed all of your pictures with doggies on them. And everybody, thank you so much for joining us today. And I'd like to just, before we close out, let you all know that you can find out more information about our guidelines, which this webinar series is linked to, and our other resources at our website there on screen. And for you practitioners out there, as Sally mentioned, we do have our online community of practice, which is also funded by the Australian Government Department of Health, Disability and Ageing. And I feel like I'm doing something quickly on the TV with very quick speaking. It's available, and that's for professionals in Australia who work with people experiencing co-occurring AOD use and mental health conditions. It's free, and you can find out more by navigating to our website and through there. The link to do that is also on screen. Thank you again, and thank you so much, Erin, for having joined us for this webinar. If you're interested in having a look at our library of past webinars, watching this one again, catching up on anything that you might have missed or sharing it with your colleagues, you can do that at our website. Our last webinar for the year will be on the 13th of November with Professor Lisa Gibbs, who will be speaking about climate change, disasters and mental health. And we hope to see you then. But until then, thank you again for joining us today. Thank you again, Erin, Dr. Erin, and please enjoy the rest of your day. Thank you, everyone.
Thanks so much. Bye.
Bye.